The COVID-19 pandemic has been deadly and devastating, not just to our church, but to our communities, our families, and our country. It has decimated families. It has put our healthcare systems under severe strain. It has even humbled us as healthcare workers. In the previous wave, driven largely by the beta strain, most of the deaths were in the elderly, the over 60s, the unvaccinated. In this, our third wave, driven largely by the highly transmittable Delta variant, most of the cases of severe illness and deaths have been in the under 60s, and in those with obesity and diabetes as the major comorbidities. And the reason? Unvaccinated. Vaccine registration and rollout opened just a little too late for so many of them. Friends and beloved family, the primary reason patients get severe COVID and land up in either hospital or die from COVID is very simple: not being fully vaccinated. It's not the hospital, it's not the nurses, it's not the doctors, it's all about whether you are vaccinated or not. So what am I saying? If you want to live and not die from COVID, vaccinate. If you want to protect yourself and your family, vaccinate. If you want our church to be a safe place, vaccinate. If you ever want to stop wearing your mask, vaccinate. If you ever want to travel again, vaccinate. If you ever just want life to return to normal, vaccinate. So I'm appealing to everyone this morning, please register for the vaccine. Go and get vaccinated. Grab the jab. You cannot afford not to be vaccinated. And just on the subject of recent COVID and vaccines, if you have had a mild illness, in other words, you have not been hospitalized, count 30 days after you were de-isolated, or 40 days from the first day that your symptoms started, and book that day for your vaccine. If your illness was more severe, requiring hospitalization, wait at least 90 days before going for your vaccination. And in that time, continue with your vitamins at least at half the treatment doses, low-dose aspirin, ACC, and steaming for at least 3 months. And then be patient with your body. COVID-19 is unlike any illness you've ever had before. Just because you've been de-isolated does not mean you're necessarily better. You may still have residual symptoms, and many of us have developed long COVID, anything from fatigue, brain fog, breathlessness, cough, chest pain. So just be patient and don't rush to exercise.